I met Lawrence not long ago in New York because after he called me or wrote to me and said to me, well, Ulrich, I'd like to support your group in Santo Domingo through Island Heat, and I didn't even know what Island Heat was. And then he told me to go to the website, and I said, okay, now I get it now. Basically, he said he did go to our HIV/AIDS conference we held at Columbia University last year, and he was very impressed by what he saw, and told me that there is a possibility for the group to invite us to introduce our work and hopefully to get some support from the members who are going to participate throughout this whole week. And he just told me that looking around, we will not probably have a good turnout because of many reasons. But the very important point is the fact that Lawrence knows about this work that we're doing, because I know he's a great promoter. He's all over the United States, and of course Kenny, whom I met here. From what I was told, he was very impressed with my aggressiveness. And so to me, I think that's sufficient for me tonight. And basically, I want to say to you briefly about what BATEY RELIEF ALLIANCEs is all about, really. It is a group that started in 1997 in the United States with the main purpose of helping to change the living conditions of the very poor in this country living in the bateys. The bateys are rural communities created by the Dominican government many years ago to house the Haitian migrant sugarcane cutters coming from Haiti and work for 6 months cutting canes in the Dominican Republic, and then they would go back to their homeland. But what happened throughout the years, they do not go back. They stay in the Dominican Republic illegally and create their own families. Because they are undocumented, their children too become undocumented, which prevents them from accessing public services in the country. Today, we have a population of more than a minimum of 200,000 people living in the bateys throughout the whole country in sheer poverty. They have no access to health care, medicines, education, and the Dominican healthcare system doesn't seem to have room to access them when they have emergency situations. So therefore, a lot of them also do not want to go to public hospitals because of fear of deportation, racism, or extreme poverty. So what we have done basically is to mobilize support in the US, Canada, and the Dominican Republic, and create health facilities for them inside the communities. Right now, we are completing the construction of a multi-Dominican million dollar facility where they would have access to pediatric care, HIV/AIDS treatment, tuberculosis treatment, and many more. This is the first time such an intervention has ever been done in this country. And we are being supported by various important institutions such as the USAID, which is the US government, the Bill Clinton Foundation, the Dominican Ministry of Health, and Columbia University. But we still have a lot to do because the population that we serve is only 12,000 a year. We want to increase it to 20,000 a year because there's so much needs in the bateys. We need to raise $30,000 in 2 months so we can completely finish the medical center. I know it may not be possible to raise that money tonight, but I hope through the great support of Lawrence, Kenny, and so many of you here tonight, you can go back to your communities and to your friends and tell them about what we are doing. I did bring with me today 100 brochures because I thought we were going to see 100 people tonight. And inside the brochures, we also have my business cards and a self-addressed envelope for you to make a donation. It doesn't matter whether it's 1 peso, as they call it, 1 penny, as they call it in Chile here, 1 penny or $100, it's something. So open your heart, open your wallets, open your purses, and make a gift to us. Thank you very much.